Hello, everyone. I hope that you can hear me correctly. I'm Laurent Haro. I'm a product manager of HORIBA Medical in hematology. We are here in Montpellier. So I'm here with Dr. DURRIEU from Bergonie Institute. She's at the head of the oncology department of Bergonie Institute. We will start now a webinar regarding the evaluation of WBC differential and flagging performances and accuracy on the HORIBA Yumizen H2500 cell counters in oncology patients. If you have any questions, feel free to write them in the chat box during the webinar. We'll try to answer them at the end of the webinar. And otherwise, during after the webinar, we will have a 15 minutes question and answer session, and then we will be able to discuss directly with Dr. DURRIEU. So I will share my screen, the presentation. 1 minute. It should be okay, I think. Yes. So now, Dr. DURRIEU, thank you.
Thank you, Laurent. So first, I wish to thank Laurent for asking me to present this evaluation. And then I do apologize for my very strong French accent, so I hope you will understand me anyway. So this evaluation was very important for us, and I will explain why. First, I have no conflict of interest to disclose. As an introduction, I will present the laboratory. So our laboratory is a collab of the Comprehensive Cancer Center in Bordeaux. There is more than 35,000 hospitalizations per year and more than 57 consultations per year. And the particularity is the existence of an early clinical trial unit. So patients followed in our hospital undergo frequent blood testing before and after surgery, before and after chemotherapy or immunochemotherapy for solid cancer, and of course, in the cases of hematology malignancies for the diagnosis, for the following of treatment and the follow-up of the disease. So in our experience, many cases and many samples have blood cells abnormalities. I will just show you 3 or 4 examples. In the cases of myelodysplasic syndrome, we often observe granulocytes with hypolobular nuclei, such just like here or here. This granulocyte have only 2 lobes. We have very often a lack of granules, an excess of immature granulocytes, like here and here, and sometimes an excess of monocytes. In the case of lymphoma or lymphocyte leukemia, we have sometimes an increase of the cell size. We have cytoplasmic projection, and we can observe also sometimes irregular shapes of the nuclei. And we also have patients with a toxic effect of chemotherapy with modification in the size of the regular cells. We have hypolobular nuclei, just like on va pas à gauche. Okay. Sorry. Yes, it's okay. So like here, or an excess of granulocytes, or sometimes a lack of granules in the cytoplasm. And finally, we have also cases with bone marrow regeneration, inflammatory response of paraneoplastic syndrome, and in this case, there is very often an excess of hematocells with excess of granules, and also cases with excess of monocytes. So on the automated cell counters, whatever they are, the differential is based on optical properties of the cells, the presence of granules, the size of the cells, and the nuclear segmentation. And cell population are discriminated by thresholds, which are determined by the manufacturer for normal cell property. So here an example of separation between lymphocytes with poor structure signal from granulocytes with higher structure signal on the right. And the threshold here discriminates the two cell population. Any alteration of these properties will impact on the distribution of the cell in the predefined area and so thus on the cell count, and will generate flags with alert us on anomaly on the differential. For example, in this case, degranulation of neutrophils decrease the optical signal of structure, and here the threshold cannot separate properly the lymphocyte population from the granulocytes. The Yumizen has a new matrix algorithm with the particularity of an automated movable threshold. So the threshold was set on normal bird. For example, here the separation between lymphocytes and neutrophils. And when there is anormality in the distribution, the threshold moves to the valley, separating the two cell population. Of course, there is an area where if the percentage is too much higher, according to the specificity of the instrument, the flag will be generated. So the aims of our study was first to compare the characteristic of the differential flags and the rate of manual counting with our current analyzer, which was at, when we have done the study, the Pentranexus, and evaluated the performance of the new HORIBA analyzer, Yumizen, technology now daily practice with a high number of abnormal samples. For this, we took 220 samples with a criteria of slide review according to ICHS or the French group for cell hematology, which represented about 20% of our daily sample. 56% were from patients with chronic hematological disorder, about 2/3 with myeloid disorder and 1/3 with lymphoid, and 44% were from patients under chemotherapy for solid tumor. So on the Pentranexus, we had an average flagging of nearly 67%. The main flag was generated by the presence of immature granulocytes, which was not surprising in our practice, and it was followed with the lymphocyte neutrophil separation flag due to abnormalities in the granulocytes' optical property. We had then nuclear red cells flag, but this is out of the study. And then we had a few monocytes neutrophil separation flag, and in 1.3% of the cases, we had no difference at all. So the Yumizen diff was compared, of course, to the Pentranexus, our regular analysis, to the microscopic count, and we did also systematically 10-color flow cytometry. 10-color flow cytometry helped us to discriminate very precisely the cell subpopulation. For example, with CD45, we could discriminate lymphocytes with high expression of the CD45 from blood cell with lower expression. CD13 and CD16 could discriminate mature neutrophil from immature granulocytes, and with also the help of CD45. We also had CD14 to discriminate monocytes, and we also, of course, could discriminate the lymphocyte subpopulation, but this is not the topic of the study. So I will present the result of this study. So when we compare the number and the nature of the flags generated by the Yumizen, we observe a significantly decrease in this number from nearly 67% to 48%, and this was highly significant. There was no significant difference with a atypical lymphocyte flag. We observed very highly significant decrease in the lymphocyte neutrophil separation flag, and the immature granulocyte flag was not different, and we had no cases with no differentials given by the Yumizen, but on the contrary, we observe a significant increase on the flag with a poor neutrophils to monocyte separation. This is an example of atypical lymphocyte separation. So atypical lymphocytes, the flag is due to a poor separation between lymphocytes with either increase of the size or cytoplasmic expansion with monocytes. And in this case, the threshold move to the value between the population, given a lower rate of atypical lymphocytes. This is an example of a decrease of lymphocyte neutrophils flag, with here a poor separation between lymphocytes and neutrophils, and the Yumizen, the threshold, in fact, decreased, and we had a very good differential, very correlated to flow cytometry. And this is an example of no diff given by the PENTRA, which perfectly separated population on the Yumizen in the cases of decreased white blood cell. And this one also was no differential with an increase of white blood cell with the PENTRA and a very good separation of the cell with the Yumizen. So we compare, for the performances of the flags, we compare with the result of a microscopic count. And we could classify the case in true positive, which are the cases where there is a flag and then we find abnormal cell, or we had to do a correction of the cell count on the manual counting, microscopic count. There is true negative, no flag and no abnormality on the cell count. False positive are flags and no abnormality on the slide, and false negative are no flag and the finding of an abnormal cells on the slide review. So the true positive rate was not significantly different, but we have a very higher rate of true negative with the Yumizen, of a decrease of the false positive, and we found no false negative with the Yumizen. Studying the overall performances and comparing between the two analyzers, so we found globally the Yumizen has a better sensitivity, specificity, positive predictive value, negative predictive value, and global efficiency. To study the accuracy of the differential, we compare the result of the two analyzers, the PENTRA and the Yumizen, with the flow cytometry. So both analyzers have a good correlation for all population. However, if we compare, so the upper panel shows the Passimba block regression, excuse me, and the lower panel is the Bland-Altman difference comparison. So if both instruments are very well correlated, and on the Bland-Altman there is no difference between the two instruments and flow cytometry for the neutrophil. However, for lymphocytes and also for monocytes and immature granulocytes, even if the correlation is very good for both instruments, the Bland-Altman analysis emphasizes that the CV of dispersion is lower with the Yumizen than with the PENTRA, and this is significant for lymphocytes, for monocytes here, and for immature granulocytes here. So we could conclude on this third part that the Yumizen had better performances for flagging and very good accuracy for for separating the different cell population. However, as we have observed a higher rate of monocytes and neutrophil separation flag, we studied 100 more samples with this flag, which gave us a total of 134. So we compare the rate of monocytes given by the Yumizen and the rate of monocytes and granulocytes given by the Yumizen with the microscopic count, and the limits of acceptance for comparison were following the rank statistics. So if we analyze the result of all the sample, we can observe that for some sample, the Yumizen give a higher percentage of monocytes than microscopic count. And of course, the percentage of neutrophil is lower. However, the Bland-Altman analysis shows that in lower percentage of monocytes, the correlation is quite good. So we did the analysis with the exclusion of monocyte counts above 10%. And in this case, we have a very good correlation of the monocytes and the neutrophil counts with the Yumizen. And this is reported here on the Bland-Altman graph, here and here. There is only one very aberrant point here, sample, but this sample has a lot of supplementary alarm, such as atypical lymphocytes. He had about 23% of atypical lymphocytes. So this explains. Anyway, this sample should have been on the microscopic slide review according to the criteria. So in conclusion, we could observe a significant improvement of the white blood cell diff analysis and reliability with the Yumizen. We had less flags, 48% against 67%. We had less need for slide review from 44% to 28%, and we had a better, much better, positive predictive value from 84% to 100%. We observed more monocyte neutrophil separation flag, and the comparison with microscopic count and application of the new rule based on the thresholds of 10% of monocytes and not monocytes, sorry, decrease our need for slide review about 1/3. So at the end of the study, we could say that we had a significant time saving in the lab workflow, and this was really very interesting in the context of a continuous increase in activity. So I have to thank all the team of the lab for helping the study, and HORIBA technical and scientific support for the study, for the land of the Yumizen and the help in this study. And I thank you for your attention.
Thank you, Dr. DURRIEU. I will check if we have some questions in the chat box. Feel free to raise your hands or to write questions in the chat box. I didn't see any. Oh, yes. So today we have one issue on one Yumizen. This case was non-case on cholangio and chemo presented on pancytopenia, and we did the CBC, which show about 80% of mono and 20% of lympho, which did not show the neutral at all. And then another machine, diff manufacturer, showed the reverse, and neutral was 80, which also seen the smear was all neutrophil. Please share your thoughts about this. Did you get it?
Yes.
Okay.
Yes, this is concordant with the observation of higher rate of lymphocyte neutrophil separation flag. In fact, the degranulation or the presence of a nuclear with a less number of lobes decrease the light signal of structure, and so the population is going down and is in the case of the Pentra, the population was going down in the lymphocyte population. In the case of the Yumizen, it is in the monocyte area. So this is not surprising, and so that's why we did this further study on the monocytes neutrophil separation. So in the case where there is a low percentage of monocytes, the differential is quite accurate. But if the Yumizen gives more than 10% monocytes, you have to check up on the slide or with another method, flow cytometry or another instrument, or I don't know.
Okay. I just want to remark that we never, you didn't present yourself, Françoise. Maybe you can share a little bit about your experience in the past and what you did exactly at Bergonie Institute, and what was your past publication, and what you plan about the close future.
Mm-hmm. Okay, so I am a hematologist, and in fact, I am specialized in hematocytology. I also work with flow cytometry since a very long time, and the lab is now a reference lab for hematological lymphoid disease for the diagnosis and follow-up. So we have a huge experience in hematological chronic pathology, and well, since 20 years now we are working with HORIBA, so it's a long time collaboration, and we were very glad to have the opportunity to participate to the development of a new analyzer. So now the future, of course, is improving the interpretation of the flags. We are working on myelodysplasic syndrome, and we try to improve the rules, which could oriented to a diagnosis of myelodysplasic with the data of the differential. Is that enough?
Yeah, of course, more than enough. If anyone wants to raise a question, to ask a question, it's now. Do not hesitate to write. Okay, something. Okay. Today we had one issue. And so Vivien, thank you for the question. And the competitors can see neutrophils because they use laser as technology. What do you mean by that? Okay. Not sure to understood your point, Vivien.
What do you mean, Vivien? By
I will
okay.
Activate your microphone, Vivien. It will be better. If you can switch on your microphone and ask directly your question.
Hello.
Hello.
Hello. Thank you, Françoise. It was very great presentation. Thank you so much. You can hear
me?
Yeah,
we can hear you, Vivien. Go ahead, please.
Okay. So now, because the question of Mr. Pradeep was about the explanation with the neutrophile, etc. But he said at the end of his question that other manufacturers can give a neutrophils count. But Françoise, you don't answer about that. You give the first part of the question, it's okay. But the second part of the question, the explanation is that the competitors use laser as technology, and the laser will analyze the nucleus. Okay.
Yes.
And this is different than our technology with LAMP.
Yes.
Which analyze the cytoplasm.
Yes. There is
granulations. So yes, that's why with our technology, the neutrophils go down, but not with the other technologies.
Yes, when the laser is used with a nuclear marker.
Exactly, as a Sysmex, we can say.
Okay. Any other questions from the audience? Feel free to write questions. No, otherwise we will conclude here. I thank again Dr. DURRIEU for the time that you spent on the travel and with us during all the studies, and again. As you understood, we will continue the collaboration with Dr. DURRIEU regarding the next study regarding a myelodysplasic syndrome. Dr. DURRIEU already started the evaluation. We will present a poster at the next ISLH in Bologna in September. In September, we will have a big ISLH event. So please, everyone here, feel free to come to Bologna on our booth. It will be in early September. We will have also a specific luncheon session with 3 famous KOL among Dr. DURRIEU again. So Dr. DURRIEU will present that study. Dr. Nair from India will present IMG, and Dr. Bola will present the clinical interest of LPF also, another parameter regarding platelet. We have a big event in ISLH in Bologna. Next week also we have some colleagues that will go to London for the ISTH in London next week. So also, if you have the luck to go there, don't hesitate to stop at HORIBA Medical booth, and feel free to visit us in Bologna or in London for ISTH and ISLH. Thank you again, Dr. DURRIEU. Thank you, everyone, to join this scientific webinar. We will continue this next scientific program, and we will see you very soon. Thank you very much. Bye-bye.
Thank you.